Welcome back to TV5 News at 9. Other than skin cancer, prostate cancer is the most common form of cancer in men and the second most deadly. Since it's Men's Health Week, we're looking at the risk factors and treatment options. And joining us this morning to tell us more, we have Dr. Hesham Gayar from McLaren Proton Therapy Center. Thank you so much for being here.
It's my pleasure to be with you.
So, Dr. Gayar, what are the risk factors when it comes to prostate cancer?
Well, prostate cancer is a very common disease. It's, as you mentioned, the most common after skin cancer, and it is really prevalent in people. If you have family history of prostate cancer, if any relatives, especially blood relatives that have prostate cancer, it puts you at risk. Practically, also African Americans are at more risk than white people, but everybody is. If you're older than 50 years of age, basically you are at risk. So this is disease that happens, and the incidence increase as we get older. Like there was one of the investigators saying that if we live long enough, we'll all get prostate cancer eventually. So it is something that is likely to happen for older people. Check it, find out about it early enough so you can detect it and get the best outcome.
So how important is it to get routine screenings, and who really needs it most?
I think, as I mentioned, the people with family history of prostate cancer, I would do it for everybody over 50 years of age. That would be my recommendation. It's basically a simple test. It is not expensive. And if you find it off, it helps diagnose the cancer early. And if you find it changing, that also is a factor. So it's important to catch it.
So, Dr. Gayar, radiation is a common prostate cancer treatment, but what is the difference between using proton therapy and traditional radiation to treat it?
Prostate cancer can be treated in the early stages for cure by either surgery or radiation equally. So surgery, prostatectomy is as good as radiation, and radiation treatment with proton therapy is a better tool to cure prostate cancer because it simply is a target that you send nanoparticles of radiation that stops at the target. So the precision is the key. Cancer that stops at the target rather than radiation going through the body. So it reduces the radiation to the normal tissue by over 70%. And that improves tolerance of treatment, makes the treatment is easier. You can just almost have no side effects. And also improves quality of life after treatments and reduces the risk of second malignancy and any problems that can happen in the long range. And people are living longer now, so we need to be careful with those late effects as well. So it's mostly side effects and quality of life and protection of tissue. It doesn't need radiation.
So McLaren Proton Therapy Center is one of only 2 in the state to offer this treatment option right now. How can someone newly diagnosed find out whether proton therapy is the right option for them?
Well, first, let me explain how proton therapy is important for cure for those patients and safety. If I have to treat the lymph nodes, for example, the proton therapy can come from the side and doesn't even reach the bowels. So people don't have diarrhea, don't have nausea, don't have vomiting, don't have side effects at all. And we're still giving the same dose that we need to give with radiation. And that's a significant effect, especially for those that require a higher dose. And there's the recent evidence that you can give higher dose and achieve more cure if you can safely give it. And that's proton is the way to do it. How to find out about us and how to call, you can simply look at the website or call us. Call 855-MY-PROTON, and that we will be glad to answer your questions. But basically, if you have cancer, or if you think, and it doesn't have to be prostate cancer, because proton therapy can treat any cancer safely without side effects. If you have cancer, ask a simple question. Is proton therapy good treatment for me? You don't have to come. You don't have to make a visit. Call us, find out. Put your information and a question in the website, or call us and ask. And we have someone to get the information. We'll have a professional respond to you with the answer. Are you a good candidate to consider this or no? Stay in your area, get this, and we can do the visits by telehealth as well. So basically call 855-MY-PROTON or McLaren.org proton therapy. And look us up, see what's going on. There are some patient stories and the equipments and more details about the treatment that I can give in those in this meeting. But it's really an outstanding way to treat prostate cancer, saving normal tissue.
Of course, and we will have those resources on our website as well. Any final tips or reminders when it comes to prostate cancer for Men's Health Month?
Yes, I would say people with change in the PSA, don't sit on it, because recent studies are showing that patients that are observed, if the PSA arrives, then it's a concern, and starting the treatment every 0.5 milliliter change when you catch it makes a difference in the outcome. So if you get prostate cancer, catching it early cures more patients and enable us to treat also less target with radiation, where proton therapy shines up and becomes a better way to give the treatment. So basically, do the screening. If you find it, ask if this is a good treatment for you. Seek help. Don't delay. Don't procrastinate. I have seen most men with prostate cancer, the women, actually, the wives, are the ones that are pushing for following up, and they save their husband's life. So act, do something about it. Please, it's your life.
Definitely. Well, Dr. Gayar, thank you again so much for being here. We appreciate your insight. If you'd like to learn more, you can always go to the information section in the hot link section of our website at WNEM.com.